So, good morning, everybody, and welcome to the Dalles Area Chamber Community Affairs. We love this. We love bringing in our different partners so that we can be informed of what's going on in our amazing community. And today we have North Central Public Health District. We love that they have more programs than we have time for. So I just know that probably for a few months to be able to explain all the programs and all the different things that they touch within our community in Wasco County. But today we're going to be talking about some of the home visits and more. And Lori and Martha are here today for that. But first, we're going to go around the room, say who you are, what organization you represent, and if you promise to keep it short, and you have something that's going on with your organization, please do that. Also, make sure that you use the chat. If you've got an event, an announcement, a flyer, throw it into the chat so that we all have access to that. And then we can grab that easily. And then at the end, Martha and Lori, I ask that by the end, you've put your contact information in that chat because it makes it super easy for our guests to grab and copy and paste and be able to take that with them. So let's start with Trish up in my upper left corner of my wonderful box. So Trish, go ahead.
Good morning. I'm Trish Neil with Legal Shield, longtime chamber member. And I still have connections to the Dalles with the original Wasco County Courthouse. And they're going to have a couple of presentations, which I'm going to also drop in the chat.
Perfect. Thank you. Bill?
Good morning, everyone. I'm actually on the board of North Central Public Health, so I'm excited to once again hear more news, and I'll leave it at that. Thanks.
Thank you. Scott?
Good morning, everyone. Good morning, Lori and Martha. Like Bill, I'm on the budget committee, so I just get to see them once a year. But I'm a volunteer for Circles of Care and also the convener for the Dementia Friendly Wasco County Partnership. And we had a meeting. I'm not sure how many of you have had this experience where you've had two meetings in 1 week and you sent out the agenda and the notice for the first meeting. But the day of the second meeting, which is today, I realized that I did not send out the notice for the meeting for today. So I'm in kind of in panic mode right now. So, but the meeting today is about the respite program, the Cherry Blossom Respite Program that's happening at St. Paul's Episcopal Church and also at the Mid-Columbia Senior Center. And they are definitely looking for those who are caring for their loved one who's living with dementia and would like a break from that responsibility. And that would be the respite program. So I'll try to find Annette's contact number to put that in the chat. Thank you.
Perfect. Thanks, Scott. Lee?
Lee Weinstein, unincorporated Wasco County. I just wrote a piece for the Oregon Encyclopedia about the Myron Frank Building in downtown Portland. I'll put it in the chat. Oregon Encyclopedia is a fabulous resource. Thanks.
Awesome. Thank you. Roger?
Technology, isn't it wonderful? Thank you so
Yes.
much. I'm on the board of the original Wasco County Courthouse and invite you to look. I see that Trish has put the flyer up on the chat. Check that out. A couple of things coming up. Also on the board of the Discovery Center, and I'm Wasco County representative of the Gorge Commission. And do want to say that I also, I'm a coin guy, and we are putting up some of my old columns up on CCC News, where they will also have a list of all the original stories and presentations made at the courthouse since 1975 and where you can get them. So do check that out.
Awesome. Thank you. Julie?
Morning, I'm Julie Reynolds at the historic St. Paul's Chapel at 5th and Union. We're going to start having tours available, usually from about 10 to noon during the market hours. We'll also have a table at the market on the 6th. And the other thing is at Fort Dalles Museum, we're going to have, oops, I switched it. We're going to have an old-fashioned 4th of July. I've put the information in the chat, but it's really, really small. So on Sunday, June 14th, from noon to 2, we're going to reenact the flag raising that was from, I think, 1905, Cascades, 1907. So Cascade Singers will be there, and people are invited to come in costume. Some of the board members will definitely be in costume, including Bob Pollock and his wife, Sue, our director, and his wife. Boy Scouts will be there, and there's going to be a talk on the history of the flag by Chris Garza, who's the executive director of the Troutdale Historical Society. Should be really an interesting event, and you're all invited to come. If you click on the teeny little flag thing in the chat, you can open it up and see more.
Perfect. Thank you. And we've got that on the calendar for you guys and in the e-blast also. So Corliss.
Morning, everyone. Corliss Marsh with Habitat for Humanity, the Senior Center, and the library. And coming up Friday, we're starting our concerts on the deck at the library at noon. So at lunchtime, bring your lunch and just sit and listen. This Friday will be Victor Johnson with his new group, Dr. Marvel and his band. So noon on Friday. See you there.
Perfect. Thank you. Mike?
Good morning, everybody. I'm with Fort Dalles Museum and the Dalles Kiwanis Club. Julie, thank you for covering the Flag Day so well. And today's speaker at the Kiwanis meeting is Dave Anderson, retired Public Works Director, and he's going to talk about the Dalles water. So hopefully there's a lot of concerns, I think, with people in the community, and hopefully Dave will be able to kind of set the record straight, so to speak. Everybody have a good day.
Thanks, Mike. Brian?
Brian Tuck, retired.
Awesome. It's good to see you. Leslie Naramore?
Morning, everyone. I'm Leslie Naramore, Executive Director of Mid-Columbia Community Action Council. And sorry I'm not on screen. I forgot to bring my computer home with me yesterday, so I'm on my phone. The one thing that I did want to share is that we're currently doing a supplies drive for cooling bundles. And so if people want to donate, we would welcome donations of bottled water, granola bars, things like that. And then those are bundles that our outreach workers take out into community during the hot summer months. And if we get enough donations and have enough bundles to share, we also distribute those to community partners to have on hand as well. Thanks.
Awesome. Thank you, Leslie. Naomi? Or Nomi? I'm sorry if I pronounced it wrong.
Good morning. Sorry, currently driving. Nice to be here. Noemi Ochoa. I am the director for Child Care Partners, which is a department at Columbia Gorge Community College. Our previous director retired in January, Nancy Patton. Here to listen what's happening in the community, but also to share. We are working to recruit anyone who's interested in starting their own childcare business. We have some cohorts starting in the fall with a nice $5,000 incentive to get their business up and going. Please feel free
amazing.
Please feel free to reach out for more information if you know of anyone who's interested.
Can you make sure that you get information to the chamber so that we can help put that out? That we get those calls, so that would be awesome if we had that.
Yes, happy to. Thank you.
Perfect. Thanks. And Liz?
Good morning, everybody. Liz Wilbur, Columbia Cascade Housing Corporation. Don't have a whole lot to share this morning. Want to thank everyone who's amplified our Carson Community Land Trust Interest Survey. The interest is coming in, so I sent that information both to the chamber and to Dan. If it's needed again, let me know. Thanks.
Perfect. Thank you. And with that, real quick, there is a ton of stuff happening for the chamber, but the main thing you need to do for me is go to our website and sign up for the 4th of July parade so that we have a 250th birthday celebration like no other. That is what's happening. And then also Business After Hours this month, which is June 18th, will be a very special one. It will be in the backyard of the chamber. We'll have a fun reception. It is a hello and goodbye. So you have a chance to sign the ribbon and say goodbye to me, but also hello to our new CEO. So we're going to cover it all at once because we want to party together. That is what we're doing on the 18th from 5 to 7 in the backyard of the chamber. At 6:15, we will be doing a toast just to have fun because you got to have fun. It's a celebration, guys. We've done a lot in the 14 years. And then I'm looking forward to the new team at the helm. They're going to be great. So with that, I'm going to turn it over to Martha and Lori, and it is all yours. And as people do questions, I'll be watching for hands raised because I know with sharing and all that, it makes it just a little challenging. And I'll also be watching over in the chat for you.
Great. Thank you so much, Lisa. I really appreciate the Chamber allowing us to come and speak about one of our many programs. And I am not going to take up a lot of air because Lori has a lot to say. I just wanted to set the groundwork. North Central Public Health District, for those of you that don't know, we are a unique health district in the state of Oregon. We're formed by an intergovernmental agreement between Wasco and Sherman counties to provide public health services, the kind of legally mandated public health services for both counties. And we do that through a variety of different programs, one of which is our nurse home visiting program. I have been in public health for about 5 years at this point. Lori has been in public health for a very long time. Lori, can you remind me how many years exactly?
It was 20 years on Monday.
That's amazing. Lori is really the heart of this home visiting program. It's what she's been in from the beginning. She has a love of helping families in this community. And so I'm going to let her take over from here. And I'm going to try to share my screen with our slides.
Okay. Thank you, Martha, for sharing the screen, so I don't have to juggle both. I'm used to presenting in person, not virtually, so it's a little bit different. I'm Lori, the lead home visiting nurse at the health department, and I'm going to share a little bit about the services available to families in Wasco and Sherman counties. So we have 3 programs. Babies First is for pregnant women and children up to the age of 5. Cocoon is for medically and behaviorally complex children and youth from birth to age 21. And shared care planning, known by our team as Spock, kind of a catchy name, involves a multi-provider team meeting that's focused on one youth's complex needs. I'll explain a little more about each program as we go. Of note, in fiscal year 2025, our home visiting team completed 815 billable visits to over 90 clients in Wasco and Sherman County. So, how our clients get enrolled. So families can request services, getting families that are hearing about us from other families. But primarily we get referrals from medical providers like Adventist Health pediatricians, OB clinics, One Community Health, Providence Hood River, and then out of the area, neonatal intensive care units like OHSU. Other frequent sources include the schools, WIC, the Family Network, Early Intervention, and DHS Child Welfare. Let's see. It's true that babies don't come with instructions, But for families that have OHP insurance, their babies can get their own assigned nurse. That's kind of what our program is. The nurse and community health worker pair visit families and are able to be the personal resource for that family for health and parenting questions. We offer a lot of flexibility. We can visit families in their homes or any place of their choosing, like a park, a track, go for a walk on the riverfront. We help support breastfeeding, answer early parenting questions, explain medical terminology. We help families access healthcare and different community assistance programs for food, for housing, electricity, and then problem solve barriers like transportation or language access for scheduling appointments. We also do health screenings to identify developmental delays early enough so families can get the services they need for their child's optimal development. Excuse me. At a previous presentation, we were asked about, is it only for Oregon Health Plan clients or is it for the public? And there's a state legislated program that some people may have heard about called Family Connects that offers home visiting for every birth. We don't currently have staff or administrative capacity for that at this time. But we've also learned that reimbursement rates are very poor across the state, especially for rural counties like ours that don't have a large enough birth rate. It may not be fiscally responsible. And several counties, including one of our larger neighbors, Deschutes County, is actually closing down their program for that, finding that it wasn't fiscally responsible. There may be more opportunities to come in the future to reach all families, not just those with Oregon Health Plan, but that's in the works. So statistics for Babies First. Let's see, Babies First kids have significantly higher rates of like up-to-date immunizations, annual well child visits, annual dental visits. All of this cost savings helps Medicaid, but most importantly, it helps families thrive. And some families don't see the value in like annual well child visits. They're like, if we're not sick, why should we go to the doctor? But one family recently shared that they didn't initially see that need to take their child in for routine checkups, but they followed the recommendations anyway. Several months ago, their child became ill, and because the doctor already knew her, the doctor took one look at that kiddo and said, yeah, we need to get something going here. I can tell something's wrong, because they knew the child. And it staved off, that prompt treatment staved off common complications from that particular illness. So the child was able to be treated without needing extensive care like in the NICU, neonatal intensive care unit. Let's see, for Cocoon, Cocoon nurses and the community health workers partner with families to help meet the unique needs for their child's care. So this is for kids birth to 21 that may have a variety of syndromes or developmental delays. We help parents develop advocacy skills along with their youth. We believe that youth, from like 12 and up should have a say in what their care is and actively encourage them to participate in their health. We coordinate care between local and Portland area providers and specialists, sometimes meeting monthly if needs and treatments are changing rapidly for those with complex health conditions. We help families learn about educational rights and support the IEP process in the schools. And we can help them get needed durable medical equipment in a timely manner, like electric pumps and feeding tube supplies, wheelchairs, bathing equipment, and oxygen tanks and supplies. And although Cocoon is a benefit of Oregon Health Plan, we do provide assessment and referral services to privately insured families because of the inherent vulnerability of the youth. For shared care planning, also known as Spock, it is the nurse-facilitated, family-focused, multi-agency meeting. It allows medical providers and education to meet in the same room, which is not a typical thing. We have a robust and dedicated standing team that includes a primary care provider from Adventist Health, representatives from Pacific Source, school nursing, developmental disability services, early childhood special education, local school K-12 special education staff, and Oregon Department of Human Services self-sufficiency. Each team member has specific knowledge and agrees to offer that one-on-one support to the family to connect them with local services. The family and their child meet with this team and their child's provider together in one room. So it might be the classroom teacher, the physical and or speech therapist, their primary doctor, the developmental disability services case manager, all to consider how the medical and educational diagnosis may differ and how to bridge that gap for the youth so everyone is on the same page regarding care needs. Medical and educational staff often have to follow different rules within their systems that aren't always known by each other. So it's really important for everybody to understand the differences to be able to work together for the families and child's benefit. Our Cocoon staff then write out the agreed upon shared plan of care, distribute it to all parties, and then follow through with the family and those care providers until all the tasks have been completed. Next slide. Other duties as assigned. What else do we do that benefits the community? We've got quite a list. Safety services, mental health promotion, Medicaid access, breastfeeding support. We have people that are featured guest speakers and board members throughout the community. Visiting staff collaborate and coordinate with other community programs and services to help prevent the gaps and enhance access to promote safe and healthy environments. Our programs, Babies First, Cocoon, and Shared Care Planning, help with the family's everyday challenges, big or small. But more importantly, we are nurturing healthy relationships that build resilience and strength in some of the most vulnerable people in our community. And that in turn strengthens the community as a whole. Thank you.
Thank you. This is where we're going to open it up and let everybody just fly in with questions. Either just shout it out or raise your hand, or you can throw it in the chat if you want, and we will make sure that Lori and Martha see those. And thank you again. That is so much that you guys do. Yeah, that's a lot. That assistance and support and help is amazing that we can have right here in our community. So thank you guys.
Jumping in, Lisa, really quickly, I just want to mention that the home visiting team is made up of Lori, who is a full-time nurse. We also have a part-time nurse who works 3 days a week. And we have 2 full-time community health workers that work alongside them. So every family that we serve is paired with a nurse and a community health worker dyad, and they work with that family together.
That's amazing. That's awesome. Thank you. Mike, you have a question.
Yes. That last list that you talked about working with immigration, how does that work? I can't quite understand, please.
So we don't work directly with immigration. We support families to get information and be prepared to know what their rights are, to have their documentation available, to make sure that their family is safe. We provide information and resources in the community. I'm not sure what else you might want to add to that, Martha.
No, thank you. I just wondered. I think that's wonderful. I think that's wonderful to be doing. Yes. Thanks.
Y'all are quiet. Do we need coffee, like pumped through the computer? I know it's early. Julie?
Do you have a lot of staff who speak Spanish or other languages?
We do. Thanks for that question, Julie. So just in the home visiting group, both of our community health workers are bilingual and bicultural. Of the 27 staff that we have, about a third of them are bilingual, bicultural, probably another, thinking in my head, I didn't have the numbers right off the top of my head, but another 5 staff are actually bilingual, even though they're not bicultural. So half of our staff is able to serve our Spanish-speaking community, which is important for us because a large portion of our community members that we serve, at least half, are Spanish-speaking primarily.
Good. Glad to know that.
We have used, sorry, I'll
no,
add
go
on to
ahead.
that.
No, go ahead.
We've used resources that have come in with grant funding and other block grants that we receive each year. We've prioritized that anytime a bilingual, bicultural staff member or a bilingual staff is hired, we support them to be trained as a qualified medical interpreter, which is sort of it's a 60-hour training. It's pretty significant and supports those folks in learning how to interpret and how to work with people who may not be used to working with interpreters, and how to provide language assistance in the best way, teaching them best practice. And so that's just standard for any person that we hire that's bilingual.
Thank you. We also have a question in the chat. Do you still do travel shots? I'm assuming that going on location and doing shots or vaccinations. I think that's what that question might mean.
Maybe Corliss can specify, because I can answer that in a couple of different ways.
I just want to know if, I think at one time I did go in there and get a shot when I was going to a country that required a shot. Do you still do those?
Travel vaccinations is what.
Yeah,
there we go.
Corliss. Yeah. So we don't at this time. Travel vaccinations can be a great service, and it's actually one of the things that we would like to be able to bring into the community again, because there is a bit of a gap, but not right now. So we do offer a lot of immunizations, but some of the more specialty vaccines that you might need, rabies vaccine, yellow fever, we don't offer those at this point. Walgreens locally is the place to go for a lot of travel vaccinations, and the occupational health clinic and travel vaccine clinic in Hood River. We'd like to be able to offer it. We have to figure out a business case for it and work towards that.
Thank you.
And Julie?
I have another question. Back in the early 2000s when I was doing health services research, multidisciplinary teams were a brand new idea. And I'd like you to talk a little bit, if you would, about how they're used in your work.
Lori, I'll let you take that. You can talk a little bit more about the Spock and how it works.
Okay, so our shared care planning is a multidisciplinary team. It's a program that started through Ben Hoffman at the Oregon Center for Youth and Special Health Needs from OHSU. He brought the program information to our community, and our community jumped on it. They said, we need this. We need to be able to serve these families with complicated health needs. We need to be able to get them services in our community, not, if a family has to travel back and forth to Portland once a week for a therapy, that's a lot. That's a big ask for families to try and work and raise children and take all the equipment that might be needed. So really getting that information and connection made here in our local community. It also allows people to understand, different programs. Like a medical provider, a parent can go to a medical provider and say, my child's having this struggle at school, but the medical provider can't write a prescription and tell the school what to do because the school follows their own set of rules and regulations through the Department of Education. So it's really the multidisciplinary team helps to bridge that gap so everybody understands how their roles might differ. And get everybody to be providing the family with the same information, because sometimes one provider will say, oh, this needs to be done this way, and another provider says it'll need to be done that way, and the family's in the middle not knowing, well, what should I do? Which really is best for my child? So bringing everybody into the same room to talk about all those things, not only medical things, medical needs, but also some of those social determinants of health. If a family is struggling to pay their rent and have enough food for their family, getting to those weekly appointments for therapy in Portland might not be the priority for them. We've had families where they've been involved, say, with DHS, child welfare, where there's, been determined some threat. Maybe it's that they're not getting their child to the medical appointments that are required or that are needed for the child. But the parents, we've had families where parents have lost their jobs because they've had to take so much time off work to go to appointments, to seek that medical care, and, all the therapies that their child needs. And it's important to try and bridge that gap to say, we really need to get this family these resources just for basic living, and then they can attend to all these. Let's do it step by step and make a plan, not throw everything at somebody all at the same time, but say, let's make a plan one step at a time to move forward toward this goal. I'm not sure if that's what you were asking, Julie.
Yeah.
But
Thanks, Lori. So I was wondering if you were able to get all the providers in the room at the same time, or if you were having to kind of triage between them all.
When we meet for the shared care planning, we invite all the providers. Sometimes there are challenges that some providers can't make it to a specific meeting. So we have a medical provider on our team. If the family or child has a medical provider from a different clinic or office, she will communicate directly with that provider to share those notes. And she can just make recommendations as the provider on our team, and then vet that with the other providers.
Thank you.
And to add on to this, there are other community organizations that also use multidisciplinary teams locally. We see benefits not just on the medical side, although I think significantly with everyone's experience with the medical system, we probably all wish we could have a multidisciplinary team talking about our care every day. So it helps with community resources also. And I don't know if Leslie wants to jump in and speak to that, because I know some of her staff participate in multidisciplinary team meetings around social supports and coordinating that care as well. But I think there's significant value. I appreciate technology very much. I appreciate the things that we're able to do. Email is great and lets us communicate with a broad swath of the population across the state, across the nation. But I still feel that there is significant value in each person being in a room together, having a conversation. And the coordination of those visits is really challenging with everyone's schedule. But I think that Lori in particular has noticed such significant impact to families and to all the providers that come around these families. They can get a lot within 1 hour of communicating directly with all of the partners, that then that shared plan of care can be carried forward. It alleviates, it's more efficient. It alleviates a lot of strain on the whole system. And I think it's really beneficial.
Hi, this is Bill. I think one of the things that really excited me about public health, North Central Public Health, was actually learning about this program, this multidisciplinary idea of getting together with others and problem solving. We have that, at least I had in my past life, when we worked with child abuse issues, and we would have multidisciplinary team meetings to come to try to focus in on developing a care plan or a procedural plan to help with kids in crisis. And so it's really enlightening to me to see that this is moving forward in so many other areas of our communities. I agree 100%. I think that if you're in the same room together, you can accomplish so much more together and to share information. And it's a great program. So thanks for having that part of it, wherever it came out of. But it's great. Thanks.
Thank you. Are there other questions? Julie's got one.
I got another one. It's really cool to know that, I mean, it used to be that medical things and social things, social services things were separate, but it seems to be really helpful to have both kinds of assistance together. And I guess that's probably what you get with the multidisciplinary teams.
Yes, we do. It is. Sometimes the educational staff don't understand the medical needs. You know, there's a lot of jargon in everything these days, a lot of acronyms that can get confusing, and it really helps to have people, you know. We had one child that we saw recently who, you know, the family was really wanting some type of occupational therapy for their child, and they were being told that their child was receiving occupational therapy, but their child was actually receiving just a consult for occupational therapy to see if they needed that. So there was just like a consult, and receiving services is different, but understanding, you know, the one agency thought, well, we're offering this, but the family's saying, but we're not getting it. And being able to understand the difference between a consult for that, you know, seeing every so often, checking in to find out if a child is needing a service, is different than actually receiving the service. So, you know, sometimes the language just doesn't fit and people don't understand, or if they think they're not getting something, or they are getting services, but they don't understand that the service that they're getting, you know, they can get the therapy, their child's receiving it at school through the school system, like speech or physical therapy, but the family, you know, isn't going to those visits because it's happening at school or at preschool. So they're not aware always of all the services.
Mike, go ahead. Mike, can you hear me?
Apologize, I was muted.
It's okay.
For some reason, my videos didn't come up. So what happens if you're dealing with a troubled family in general? Do you have any counseling for the parents? I mean, seems like that would also enter into the care of the child in general.
As part of our Babies First and Cocoon programs, parents are included and can be enrolled themselves in the programs if they have specific health needs or health-related needs, where we can help them get connected with services. Part of our program is really building that relationship with the family, that trusting relationship, so they, seeing someone, talking to someone on the telephone or having an appointment for 15 minutes is very different than having someone come to your home and spending an hour, with you every month, month after month, getting to know your family and interacting with your family and building that level of trust, to be able to help families access those resources, whether it be counseling or medication or self-care activities, where families can, make a difference, make different choices in their lives. We have several families that we've worked with over the years that have had substance abuse problems, and, helping support them to move forward in parenting has been, it's been wonderful to see the changes and the things that families can do when they're ready to make those changes.
Thank you.
Roger?
I just have one thing. If you had one wish, one magic wand wave to make something better for you in many ways, what would that be?
Better for me or better for our families and our community?
For your pick, both.
For families, I would like to see a higher level of care in therapies available in our community. There are a lot of families whose kids can't access care because their developmental challenge is at a higher level than our community providers can provide. So we have kids that can't get therapy that's recommended and very beneficial. Because there aren't providers in our community. We've had families try to move to other areas, to Portland, but financially they can't. They can't make that jump. So their kids just aren't getting the therapy. They're not getting speech. They're not getting physical therapy. They're not getting ABA therapy, which is like a behavioral therapy for autism. That would be one of my wishes. For myself, I don't know. I'm pretty happy where I'm at.
That is so good to hear. Thank you.
I didn't pay her to say that either. She just said that. One of the things kind of on the tail of that question, Roger, that this is sort of hot off the press. We're going to be presenting this information to our board on Tuesday, but as part of, I'm not sure if this group has heard of the Rural Health Transformation Program. So out of House Resolution 1 at the federal level, that unfortunately is causing significant cuts to Medicaid in our community. One of the things that came out of that House resolution was a significant chunk of money was set aside to invest in healthcare infrastructure in rural communities. it unfortunately is only a drop in the bucket compared to the cuts that we're experiencing with Medicaid. However, Oregon did receive $200 million grant over the next 5 years to invest in rural communities. There are different phases of this grant that are happening. We're currently in phase 2, which is called the Catalyst Awards. And there was an open grant application put out by the Oregon Health Authority. Because of the way that the grant was executed and rolled out, the first budget period is very short. It ends in September, as a matter of fact. And the state needed to get funds out quickly in order to not have to give them back, to be honest. And so in the public health department at the state level, we had some strong advocates that advocated for public health, local public health authorities to have a specific carve out for this funding, because we already have funding mechanisms. We generally have lists of ideas of what we could do if we had funding. And there were a couple of caveats to this. It had to be a new or expanded program. And there was actually significant emphasis on home visiting. And so our community, over about an 18-month period, has the potential for getting $424,000 through public health. And so we had to very quickly come up with a budget and a plan. And we decided that our home visiting program and all of these things that we just presented to you were things that we really wanted to invest in and be able to expand in our community. So we are focused on hiring another nurse home visitor for our team and expanding services to anyone who has a baby in Wasco and Sherman counties, regardless of their insurance type. So this funding would allow us to kind of supplement, try this pilot program for a year and see if the funding continues, number one, and we can continue it, or number two, if we can find other funding mechanisms to keep it sustainable for the long term. So we will be trying that pilot and expanding services for Cocoon, Babies First, and that multidisciplinary team, the Spock team.
Sweet. Every once in a while, the government comes through.
Yeah.
Thank you. Do we have any other questions? So Lori and Martha, if there was anything that you would want us to go away with just as a last minute thought, what would that be?
I can add a little addition.
Okay.
My thought would be that if I could wish for anything, would be a new building for the health department, because where they're located is such an old, antiquated concrete structure. And the county would love to be able to do something with that property, I'm sure, in the future. And so if there was any way that we could find the resources and to be able to move on to at least a more appropriate building that could help serve the community better, would be absolutely perfect. So
that sounds like a great wish. Sounds like a good one, Bill. So anything else you guys want to add?
I would just say that if you guys know anybody that is in need of these kind of services, that the multidisciplinary team, any family that's struggling or has those kind of challenges, please send them our way.
Sounds like a great idea.
And
this is a community that puts and rolls up their sleeves and helps. So yes.
Yeah. And the final thought that I would leave you all with is this is just the tip of the iceberg for what we, as a very small public health department, we do a lot of different programs. And if anyone is interested to learn more about what we do, I would say that that's something that we haven't been able to do very well, is let the community know about the different ways that we serve. And so if you are interested, please do contact me. I'm happy to have a conversation and let you know about the things that North Central Public Health does.
And I think we probably need to look at a couple of those programs and bring you back on so that we can continue to do this. So the more educated we are, the better our community is. So if there's no further questions, I say we all get a few extra moments to have that extra cup of coffee. I know I need one. And you guys have an amazing day. There's a lot going on in our community. Just check out the community calendar on thedalleschamber.com. You will have more than you can accomplish, I promise. This community is great about having those events and supporting our partners around us. So take care and do that, and we will see you all next week. And happy Thursday.